Most people don't get better answers about their health because they're not asking better questions. Now, I want you to really sit with that for a second because when it comes to healthcare, we're taught to be good patients, right? We're told to trust the doctor, we're told to follow instructions, take the medication, and hey, come back if anything feels wrong. And for the most part, we actually do that. We show up, we listen, we nod our heads, and we even try to follow the plan. But here's the problem: almost no one really ever teaches us how to ask the right questions in the first place. And I believe that is what creates a serious gap because if we don't know what to ask, we don't know what we're missing. We don't know what was not explained. We don't know what assumptions are being made about our care. And more importantly, we don't know what information could actually change our outcomes. So, what ends up happening is this: we leave the appointment thinking, like, okay, I think I understand, but deep down, there's still this uncertainty, right? There's still there's still gaps. um, there are things that didn't quite click, and over time, those small gaps turns into those small gaps turn into misunderstandings, and then in turn, that turns into bigger problems because healthcare decisions don't happen in the office; they happen at your home, they happen in your daily habits. They happen in the choices you make when no one is watching. And if you don't fully understand your health, those decisions become guesses. So today, I want to help you change that. So I'm going to walk you through something that I think is incredibly important. And I'm speaking from personal experience. I'm going to walk you through how to know if you're asking the right questions about your health and what to do if you're not. So let's start here. Most people, we struggle not because that we don't care, we struggle because the system makes it hard, right? And I think these are a few reasons why. One, we don't know what we don't know, okay? Healthcare is already complex, it's layered, it's nuanced, and if we don't fully understand our conditions, our lab results, or even our treatment plan, boom, three strikes against us. you know how can we even know what questions to ask? So you can't ask about something that you don't realize exists. So instead, you ask what feels safe, or worse, you don't ask anything at all. And then there's two, the time pressure. And let's be honest for a second. Most appointments are short, and we get 10, 15 minutes tops if we're lucky. And during that time, you're expected to listen, you're expected to process, respond, and then ask questions, right? That is a lot in that time frame. And so what happens? You default to surface level questions because you're panicked because you're rushed for time, or you don't even ask questions at all. Okay, and because there simply isn't enough time to truly slow things down. And then number three, intimidation. Healthcare environments can feel intimidating. So you walk into this room and you're surrounded by medical terminology, fast-paced conversations, it's cold, and then these professionals who speak with certainty and naturally. You may feel like, okay, I don't want to sound dumb. I don't want to ask the wrong thing. I don't want to take up these people's time. So you're already shrinking yourself by staying quiet. And it's not because you don't care, but it's because you do not feel comfortable, right? And then there's the emotional overwhelm. And this one is huge because when you're dealing with your health, you're not just thinking logically, you're feeling, you're anxious, you're uncertain, and in some cases even scared. And then, when your emotions are heightened, your brain it shifts into processing mode rather than analytical mode. And so instead of thinking, what questions should I ask? You're thinking, okay, what is happening to me right now? What does this mean? Am I okay? And that makes it even harder to ask meaningful questions. So there's that. And then number five, you assume everything important was covered, right? And I believe that that is one of the biggest misconceptions because you think, well, if it was important, they would have told me. But the reality is, doctors are managing time constraints, they're managing multiple patients and their own systems, right? And so they often just stay focused on the diagnosis, the treatment, and the next steps. But that doesn't always mean that you fully understand what was said about that gap, right? And I believe this is where the problems begin. Okay. So now let's just talk about the cost of asking the wrong questions. Okay. So, what are some of the things that happen when you do not ask the right questions? And, it isn't just about curiosity. This actually impacts your income, not your income, but your outcomes. So, there's one false confidence. You walk away thinking, okay, I got it, right? But do you really? And I think that false confidence can lead to poor decisions, okay? And then there's missing information, the details that matter because they were never clarified. And because you didn't ask, you never received them. And then my favorite, misinterpretation. You heard the information, but then you interpreted it just slightly different. And now you're acting on incomplete understanding. And then there's lack of ownership. So when you do not understand your health, you don't fully take ownership of it. You just follow the instructions. You're not engaged, you're not confident, and you're not proactive. And all of these behaviors, it leads to inconsistent care, delayed action, unnecessary anxiety, and worse outcomes, unfortunately. Because again, you can't act on what you don't understand, right? And so now let's just jump into the gap between doctors and patients, okay? And this is something that I really want you to understand. Doctors and patients they're operating on two completely different perspectives, all right? Doctors, doctors understand the system. They understand the terminology. They understand the patterns. That's what they were trained to do. But patience, we're experiencing this for the first time. We're emotional. We're trying to keep up. So, something that feels clear to a doctor may feel overwhelming to a patient. And because of those time constraints, that gap often stays underaddressed. And it's not because anyone is doing something wrong, but because the system is not built for deep understanding. Okay. And this is exactly why learning how to ask better questions is one of the most important skills you can develop as a patient because when you ask the right questions, you unlock clarity, and clarity can and will change everything. And if this is making you think a little differently already, stay with me because, now I'm going to jump into what good questions actually look like and how you can start asking them immediately. So let's just jump right in. What does a good question actually look like? So, what's a good question for starters? So, good questions do one thing, right? They create clarity. Okay. So, we're going to just break it down in some categories. Okay. So, the first one, understanding the questions, right? And here are some examples. What does this actually mean for me? Another example. How serious is this? Okay, so those are the understanding questions to get a better sense of what's happening once you receive this diagnosis. The second category, cause questions. My favorite. Why did this happen? Another example. What could have contributed to this? Was it environmental? Was it stress? Was it something I ate? Just to get clarity there. And then the next category would be impact questions. What happens if I don't treat this? And my favorite, what should I expect long term? Always ask that, especially if you're taking medication for an extended period of time. Always ask because those side effects are real. And then number four, the fourth category, action questions. What should I be doing differently? And you push about this too, because that may say something like, oh, well, just, eat whatever, or just eat these meat. Ask, really, ask with confidence too. And then the next example is, what actually makes the biggest difference? And you'll be surprised when you get the answer by that, or the answer to that. And so the next category will be risk questions. What should I watch out for? When should I be concerned? And that definitely is an important question, especially if you're starting to notice some changes in your body. And then the next category, clarity questions. Can you explain that to me in simpler terms? Or can you walk me through this again? Just again, just so I can just fully grasp it. It's okay to ask for clarity. It's always okay. All right. So next, how to start asking better questions. So this is what I want you to do. Prepare before your appointment. Write these questions down, either save it in your notes on your phone or just print them out or just write them on paper. Focus on understanding, not just instructions, okay? And then ask follow-ups. Don't stop at the first answer, okay? Keep pushing, keep pushing. And next, slow the conversation down. You're allowed to say, you know what, can we pause for a second? I just need a moment to process that. Okay. And the next one, use some tools. Alvora.health is a prime example. And you can use these tools to process information after your appointment. Okay. So, I really hope that was helpful for you. And I just also want to let you all know this is exactly why I built Alvora.health, because I've experienced, leaving appointments without clarity, and not because I didn't try or because I didn't know what to ask, but, just the same things that I just discussed, I too experienced that because I believe that we patients deserve better because we deserve clarity, we deserve confidence, we deserve understanding because when you ask better questions, you get better answers. And when you get better answers, you make better decisions. And you know what that leads to? Better outcomes. Because better clarity leads to better understanding. And so if this resonated with you, I just want you to subscribe because there's a lot more from where this came. Because in the next video, I'm actually going to discuss, I think, something that's just as important, and that is how to understand your lab results in simpler terms. See you next time.